This article that I was looking at has to do with what has been going on and has not really been talked about very often, which is organ harvesting and human trafficking, and it's a black market for it. And so it was dated November the 12th, and this is out of a science staff, decoding science staff. And usually what happens is someone that's been on a waiting list for an organ, if they have health issues like they need a liver, they need a heart, they need a kidney, they need a hip replacement, usually they're tired of waiting on that long list. They don't want to die. They might have not very little time before they end up dying of whatever their illness is. They want that organ right away. And so it brings about a desperation to get that organ, even if it means going on the black market to purchase an organ. And you don't know where those organs have come from. They might have come from someone killing someone that has been humanly trafficked. It could come from a missing person that they've been looking for, and they open the person's insides, pull all the organs out, harvest them, and sell them on this black market. And so this is big business, and they make lots of money doing it. And it's been going on, and it's not only in the U.S., it has happened in China, it's happened in a lot of other countries as well. And so when families or individuals are tired of spending years on a medical waiting list, they sometimes purchase body parts like kidneys, eyes, lungs, hearts, limbs, and more for transplant on the black market. And so it sounds like it's a science fiction type of thing, but the organ harvesting is an unfortunate fact in the criminology world of today. So human trafficking has a lot to do with it. And recently, there has been an issue with human trafficking, and it's even bigger than ever before. And it's not just prostitution and exploiting people sexually, it's also taking body parts and selling the body parts on the black market. And so organ harvesting has been tied to human trafficking as well and has become a booming business in the 21st century on a global scale. So it's a criminal offense to the trafficking body parts and performing transplants from any source that's not legally affiliated with a hospital or a medical facility. But legality doesn't deter either side of the transaction. Like I say, if somebody's been waiting on a long list or they know that they could die soon, they don't even want to know where they got the organ. They just want to hurry up and purchase it by any means necessary. So notably, quite a lot of illegally trafficked body parts are harvested by any means necessary, of course, and are gladly received, no questions asked, by persons willing to pay top dollar for a kidney, a heart, or a hip. Now I'm going to stop. Recently, they found truckloads of body parts, or bodies. I won't say body parts, but bodies. This is already bad enough as it is. But bodies in refrigerated trucks of people who died of COVID-19. Getting back to this article on how you can make a lot of money on trafficking, human trafficking, and harvesting organs on the black market. You don't think that some of those organ parts might end up in this black market? It's possible, especially if people are desperate for money. Remember, by any means necessary. So illegal organs, supply and demand. According to the American Transplant Foundation, 123,000 people in the U.S. are on a waiting list to receive organs. Every 12 minutes, a new name is added to the list. An average of 21 persons per day die due to the lack of organ availability. Corneas, kidneys, livers, lungs, intestines, bone marrow are most common in transplant needs. The U.S. Department of Human Health Service data of organ procurement and transplantation network reports 121,333 currently awaiting organ transplant, of which 30,402 are waiting for a kidney. Only 30,970 transplants actually took place legally in 2015. According to the World Health Organization, America is one of the many organ importing countries, and by the use of the web, patients can get transplant packages from $70 to over $160,000. So the USA Today conducted an investigation reported that in 2006 it found that an illegal body harvesting is very lucrative in the U.S. Due to the high demand of body parts, the investigation revealed that in 1987 to 2006, 19 years, over 16,800 families had pursued lawsuits stating that their loved ones' body parts were illegally sold for an estimated $6 million. So that amount is based on figures obtained from the federal and the local investigators, public organizations, and medical universities. Where do the organs come from? Willing donors, and in some cases, NBC Chicago investigative reporter found that people even boldly advertise their kidneys on the sale of Craigslist. The investigation revealed that hundreds of people in Illinois were willing to sell their own kidney for a few $1,000s. This is people who are desperate for money because what's going on right now? I know it seems far-fetched. People are worried about being evicted from their houses. They're worried about not being able to pay bills and rent. People are being forced to go back to work in conditions where they might get sick. What do you think people might do if they're on edge and they're hurting for cash? There's a lot of things. What do you think people might do if, let's say, you have all these bodies and somebody works around multiple bodies that have somehow they don't know where to put these bodies? You think this can open up a whole new market for this thing? It's a possibility. Anything's possible. So where do the organs come from? Willing donors, they say. People who are waiting for, like they need a kidney, they need a liver, they need a heart because they don't want to die. Or they're willing to sell their body part on Craigslist for a couple of $1,000s because they're hurting for the cash. After discovering a Chicago area man who was offered $30,000 for his kidney and received several hits in 1 month, they went undercover posing as a person willing to sell their kidney in exchange for emails from organ brokers. Yes, they're organ brokers, as well as doctors who were willing to perform the transplant for a fee as well. So there are doctors in on it as well. So unfortunately, many people become victims of illegal organ trafficking industry as well. So organs, trafficking laws, and offenders. So who are these people? Organ trafficking is a form of human trafficking and is an organized crime according to the United Nations Gift Hub. Organ trafficking falls into 3 categories. Traffickers who trick the victim into giving up organs for no cost. Con artists who convince victims to sell their organs but do not pay or pay less than they agreed to pay. Doctors who treat people for ailments which may or may not exist at all, and all they do is remove the organs without the victim's knowledge. And so the organs are trafficked, the trading involves a host of offenders. As the UN gift noted, that there is a recruiter who seeks out the donor, and there is a transporter of the organs. And there are staff of hospital and clinics that receive the organs, and of course medical practitioners who perform these transplants. And there are also middlemen, contractors, and buyers, and the banks that store the organ tissues as well. So Decoded Science intervened, a former transplant clinical researcher for a major hospital who spoke with us under conditions of anonymity. They didn't want to be recognized because of probably what hospital they worked for. So there's been several hospitals that have been involved in this, and they've tried to conceal the names of these hospitals. He stated that he had encountered cases where people brought or bought their organs from people willing to sell them. And he shared the experience of elite Saudi Arabian who arrived at the hospital for a kidney transplant accompanied by a young man he claimed that was his brother. Testing showed that there was no genetic match, and the researcher later found out that the Saudi elite had paid the young man $50,000 in the U.S. money for his kidney. Our source also noted that even though there is a waiting list for organs, favoritism does occur. Money can get someone moved up on the list fairly quickly. So if you are a rich person or you're wealthy or you have a lot of money, you can get moved up on the list very quick to get that organ to save your life. So Ann Cheney, author of Body Brokers, instead wrote, Inside America's Underground Trade in Human Remains, stated that today we aren't robbing graves, but we are violating corpses. We are failing to carry out donor wishes, and we are putting patients at risk, all because we have been distributing or are disturbingly complacent. Meaning people know this is going on and they've been knowing it's going on. They're complacent about what happens to people's bodies when they die. And so a lot of times when people die, they probably will already pull all of or harvest all of the organs out, and without your knowledge of knowing where these organs are, or before the people, the family members can even say what happens to the body, the organs are harvested and already sent off to all these people who need the body parts, the kidneys, the liver, and whatnot. So the real life body snatchers. According to NBC New York Levi Rosenbaum, this is a guy who was first known as the first U.S. broker of selling kidneys. And so he was a kidney broker. He was sentenced to 2.5 years in prison and was the first proven case of organ trafficking. And his indictment came by an FBI sting operation in the black market sale of 3 kidneys for a totaling of $410,000. So Rosenbaum recruited poor Israeli donors who sold him their kidneys for $10,000, and he resold the organs to Americans for over $120,000 apiece. And so he told undercover FBI agents that he arranged for a lot of transplants to be taking place and sold them to an Albert Einstein Medical Center in a hospital where he had acted as a facilitator for donor matches for Israeli patients from 1999 to 2000. So killing to give life. In addition to the con artists, the unscrupulous doctors as well, there are also extreme cases in which people are outright murdered for their organs. And so every year there are suspicious deaths. So whenever you wondered why are all these people on these milk cartons and they're missing, what happened to all the missing persons? Why can't they find the bodies of these people? Well, guess what happens? There are suspicious deaths in which the victims had their organs removed. So, scenarios, at least about 4 of them. 2012, Vance Anderson, 51 years of age, old painter of Philadelphia, died at a Thomas Jefferson University Hospital in Philadelphia due to a complication from a lung condition. But by the time his mother was to claim the body for the burial, his eyes, his heart, his brain, his pancreas were all removed. The explanation that was given to that the organs were donated for education, but this occurred without the family's consent. 2013, Kendrick Johnson, 17-year-old student of Georgia, was found dead inside a mat at a school. The death was ruled an accident. And I don't know if you guys saw that on YouTube. They had this black kid that he was killed, and they wouldn't show you who might have done the killing, even though they had video of the kid walking down the hallway. And then when they found the kid, he was rolled up in a mat and his organs were harvested, of course. When his parents demanded an independent investigation, the second autopsy revealed that his internal organs, brains, lungs, liver, were all missing, and the cavities were filled with newspaper. And so this was on WSB TV. So 2014, Ryan Singleton, 24 years of age in Georgia, went to California to pursue acting jobs. His body was discovered in Death Valley with multiple organs removed. Eyes, heart, lung, liver, kidneys, all were missing. The rest of the body remained intact. The investigators told the family that his organs may have been eaten by wild animals. This was reported on WGN-TV. 2015, Nicholas Rodriguez, 24 years of age, California State Prison inmate. And this has happened where prisoners are even at risk. He was found after a 15-hour prison riot in a garbage can in a shower next to his cell. His body was almost cut in half, and his abdominal, his chest organs were all removed. This mutilation occurred in a medium security prison with surveillance, and this was put out by the Huffington Post. So the highest bidder gets you. And so the demand for kidneys has reached an epidemic level right now in the U.S., and people are willing to buy and sell through the networks. And so even on the internet, people have a black market. There's a black web for body parts. And so even though this is illegal and punishable by jail plus a fine of $50,000, who cares? That's the way these criminals think. We're not going to get caught. What they don't know doesn't hurt. Or does it? The stories I just read prove, yes, it does hurt. The family's hurt. And the people that you're doing this to definitely are hurting. So the FDA is regulating body on buying and the sale of organ body parts. However, the FBI, who has made many arrests, who is protecting your body, or who is protecting your body or body of your loved ones? That's the question. And so that first case that I was telling you about, this was the first case of organ trafficking in the U.S. by a New York man accused of buying kidneys abroad, selling at a hefty profit. And so that article was put out by Carla K. Johnson and David Porter, and this was back in July of 2009. So in Newark, New Jersey, Levi Ishak Rosenbaum called himself the matchmaker. But his business wasn't romance. Instead, authorities say that he brokered the sale of black market kidneys, buying organs from vulnerable people from Israel for about $10,000 and selling them to desperate patients in the U.S. for as much as $160,000. An alleged decade-long scheme exposed that week by the FBI sting rocked the nation's transplant industry. And so the charges, if they were true, which they turned out to be eventually, would be the first documented at the time case of organ trafficking in the U.S., transplant experts said that Friday. And so there's certainly cross-national activity, but it hasn't touched the U.S., or they didn't know about it until that time. So the University of Pennsylvania medical enthusiast Arthur Kaplan, who is a co-directing of the UN Task Force on International Organ Trafficking. Rosenbaum was arrested that Thursday, 10 days after meeting in his basement in New York City, Brooklyn borough, with a government informant, an FBI agent posing as an informant secretary. The agent claimed to be searching for a kidney for a sick uncle on dialysis who was on a transplant list at a Philadelphia hospital. So I am what you call the matchmaker, Rosenbaum said in a secretly recorded conversation. I bring a guy what I believe he's suitable for, your uncle. And so, asked how many organs that he had brokered, he said quite a lot. The most recent 2 weeks earlier that year. So organs for export. As part of the scheme, the organ donor were brought to the U.S. and were then underwent surgery to remove the kidneys, authorities said. So prosecutors did not identify these hospitals in the U.S. to receive the donors and their kidneys. So some hospitals were involved and some other key players were involved for this to take place. So the allegations about the organ trafficking ring in the U.S. are appalling. And this was said by a John Davis, CEO of National Kidney Foundation. Israel Medical Association spokeswoman Orna Cohen said that the organization had no reports that there were Israelis selling organs. But if it was true, which it turns out that there's some truth, lots of truth in it, then it's shocking. And it's still shocking. And it's a big business today. And so Mickey Rosenfeld, a spokesman for Israel National Police Force, and Israel police were not involved in the investigation, and he would not comment further on the issue. So under 1984 federal law, it is illegal for anyone to knowingly buy and sell organs for transplant. The practice is illegal just about everywhere else in the world as well. But do you think people listen to that? Probably not. So in high demand, it is. But the demand for kidneys far outstrips the supply. 4,540 people dying in the U.S. that year, 2008, 2009. Last year, while waiting for the kidney, according to the United Network for Organ Sharing. And so as a result, there is a thriving black market for kidneys around the world. And even till this day in 2020, 2019, that article I read, still there's a booming business for it, even more so globally. So Shepard Hughes said that she was told that Rosenbaum carried a gun. And so here's the transaction. Self-described matchmaker Rosenbaum is accused of federal authorities of acting as a broker and trafficking human kidneys for transplant. Here's what authorities allege in the FBI sting operation. The government informant, undercover agent, approached Rosenbaum to buy a kidney. The fee was $160,000 and is discussed half up front to cover the cost of the Israeli doctor and the donor and the expenses to care for the donors following surgery. So the recipient's blood sample is sent to the Israeli for screening, donor flown to the U.S. hospital for organ matching. Prosecutors say that 4 checks totaling $10,000 were deposited into the bank account of a charity. And so that's how the transaction went down. And so that's what was stated. And so Nancy Shepard Hughes, an anthropology professor at the University of California at Berkeley and the author of the upcoming book on human organ trafficking, said that she has been tracing the Brooklyn connected ring for that 10-year span. And so her contacts in the Israels have called Rosenbaum, he was the top man in the U.S. at the time. So Shepard Hughes said that she was told that Rosenbaum even carried a gun when he potentially had made the sale. A potential organ seller would get cold feet and Rosenbaum would use his finger to simulate firing a gun at the person's head. And so Shepard Hughes said that she was also told that some of the kidney transplants using sellers procured by Rosenbaum were performed at Mount Sinai Hospital in New York as well. So the hospital said that it is aware that Rosenbaum has been charged, but its transplant screening process is rigorous, and so that it assesses each donor's motivation, so all the donors are clearly advised that it is against the law to receive money and gifts for being an organ donor. Spokeswoman Brenda Perez wrote in an email, but the pre-transplant evaluation may not detect premeditated and skillful attempts to subvert and defraud the evaluation process as well. So Rosenbaum was arrested in a sweeping federal case that began as an investigation into money laundering and trafficking in kidneys and fake designer bags as well. So it mushroomed into a political corruption probe, culminating in the arrest that week of 44 people, including 3 New Jersey mayors, various other officials, 5 rabbis, politicians. Rabbis were not accused of their involvement in organ trafficking. But Rosenbaum, at the time, he was 58 years of age. That was back in 2009. So He is the member of an Orthodox Jewish community in Brooklyn Borough Park section where he had told neighbors that he was in the construction business. So for someone who was not a surgeon, Rosenbaum seemed to, in his recording conversation, to have a thorough knowledge of the ins and outs of kidney donating, including how to fool hospitals into believing that the donor was acting solely out of compassion for a friend or a loved one as well. So he was very clever. He's also had skills in being a con artist, is what it's saying. So he was recorded saying that his money had to be spread around liberally to the Israeli doctors and visa preparers and those who cared for the organ donors in this country. And so one of the reasons it is so expensive is because you have to smear or smear and pay others all the time. He was quoted that he was saying. So far I've never had a failure. He bragged on tape. So I'm doing this a long time. So thriving black market it is. And it says in 2008 meeting with the undercover agent, Rosenbaum claimed that he and an associate worked for an insurance company in Brooklyn who could take the recipients' blood samples, store them on dry ice, send them to Israel, and where they would be tested to see if they matched the prospective donors. Authorities would say that this is how they did it. And so 4 checks that were totaling $10,000 was a down payment on the fictitious uncle's new kidney that were deposited in the bank account of a charity in Brooklyn's prosecutors said. After hours of phone call with Rosenbaum's lawyer, Ronald Klingberg was not immediately returned that Friday. And so in that year when they were investigating, so Dr. Francis Delmonico, a Harvard professor of transplants, is going on elsewhere around the world. So a transplant surgeon that's a board member in the National Kidney Foundation, a board of directors. Similar trafficking is going on elsewhere around the world, she said. And so it is. And so which brings me to this. Okay, so it is estimated that 10% of the kidney transplants, 5,000 to 6,000 each year, are done illegally. Hotspots are Pakistan, Philippines, and yes, China, where it is believed organs are obtained from executed prisoners, he said. And so that brings me to the prison population as well, are very vulnerable to the organ stealing. And so Kaplan, the University of Pennsylvania enthusiast, said that he expects the UN task force to make recommendations in October that hold hospitals worldwide accountable for establishing origins of each organ that they transplant and whether it is freely donated without compensation. And so there is a black market also exclusively for kidneys, and that's a big deal. And so here in Los Angeles, and I'm sure in other places, I see dialysis centers in most little places, especially in a lot of poor communities. And so all international medical groups and governments ought to condemn any marketing in body parts. And dialysis is to help people who have, kidney problems and they need help staying alive or whatever, and so they get dialysis, they're on dialysis, and so you have kidney failure, and so there's so many people that need kidneys, and I noticed that, or they have weak kidneys, and so that's a big deal, and so that's probably the biggest marketed organ around. So all international medical groups and governments ought to condemn any marketing in body parts. So it's simply too exploitive of the poor and vulnerable. And so the quality of the organs is questionable. So that's the other thing. So people lie to get the money. And so the middlemen are irresponsible and often criminals, and they don't care about the people who sell. And so bad name on good people. And so before I go into that part of the article, you don't know where you're getting this organ or body part, where it's coming from. And that's the other thing. And so people are so desperate. The person could have been sick. They could have been ill. And recently I saw an article where they said that there was a truckload of bodies they didn't know where to place them because so many people had died of COVID-19. So if there's such a huge market in kidneys and all of these things like this, and people are hurting for cash, like a lot of people are hurting for cash right now, you wouldn't think that they wouldn't try to take some of the body parts that people of the deceased from this disease, and take some of those body parts and put them on the market. Criminals, it's a possibility. Bad name on good people. So Shepard Hughes said that her research has uncovered hundreds of cases of illegal organ transactions brokered by the Israelis in Israel, South Africa, Turkey, and other countries, with sellers recruited from poor communities in Moldova, Brazil, and elsewhere. And so it goes on in a lot of countries. And so it's a big business, and a lot of criminals are in on it. And criminals don't look like your average criminals. Some of these people might be in good positions of power or prestige, or they might hold jobs, and you wouldn't think they're involved in this racket. And so they usually prey upon the poor and vulnerable. And so a few transplant surgeons support changing the law to allow a system of regulated compensation to increase the pool of donor kidneys. And so it would minimize the also Arthur Matas, the transplant surgeon who directs the kidney transplant service of the University of Minnesota Medical School, said the donors could be compensated with some combination of lifetime access or assessments to the medical care, life insurance, tax credit, and help with college, and small direct payment, and it would minimize the extraordinary black market of exploitation of impoverished people internationally, Mata said. So Martin Wenzel, who lives around the corner from Rosenbaum in Brooklyn, said the allegations bring shame to the community as well because of who he is and where he's from, and he's supposed to be from a particular religious group. It puts a bad name on good people, he said. So religion is supposed to be about God helping others, not about the cash. And so that's in that article. And so the first article was about the human organ trafficking. And so where are the countries that are most prevalent in doing this? Organ trafficking prices and kidney transplant sales. So organ trafficking is the buying and selling of kidneys and livers and other human organ body parts. Listed below are prices of organs and kidneys sold on the black market. And so this article, and it's probably not that much different from what it was back then, it's showing you the cost. And so basically you see full post of statistics about organ trafficking. You also see other related information, but this will tell you, you can click on it, but the organ trafficking facts were taken from news stories and medical publications and other public reports, illegal organ trades and stuff, so on. So the amount of money that was paid to the organ for the organ donor. And so the money paid to the donor who sold the kidney is listed in US dollars. And so human organ trafficking prices. Okay. And so the average paid by the kidney buyer, the seller of a kidney. And so the average paid of a kidney buyer would be $150,000. And so the average paid to the seller of the kidney is $5,000. And so the kidney broker in the Philippines is $1,000 to $1,500. Kidney brokers, these are all kidney buyers, brokers, and sellers. Okay, so you can look on down the list. So kidney broker in the Philippines, kidney broker in Yemen is $60,000. Kidney buyer in China is $47,500. Kidney buyer in Egypt is $20,000. Kidney buyer in Israel, $125,000 to $135,000. Kidney buyer in Moldova is 100,000 to 250,000. A buyer in Singapore, 300,000. A buyer in South Africa is 200,000. Thailand is 10,000. United States 120,000. Yes, the U.S. still has people involved in this racket. Saudi Arabia 16,000. Bangladesh 2,500. China 15,000 is the seller. Bangladesh, the seller was 2005. So these are people who are selling their kidneys. Costa Rica, these are sellers. Costa Rica is 20,000. Egypt is 200,000. India is 1,000. Israel 10,000. Kenya is $650. Moldova 2,500 to 3,000. Pakistan is 10,000. Peru is 5,000. Romania 2,700. Thailand, these are all sellers. Once again, people selling their kidneys. Romania 2,700. Thailand 3,000 to 5,000. Philippines 2,000 to 10,000. Turkey 10,000. Ukraine 200,000. Vietnam 2,410. Yemen 5,000. And so traffickers in Turkey make $10,000 profit. Transplant operations in China is 15,200. Transplant operations in Europe also is 32,000 in China. The buyer is 21,900 in China. Once again, the seller is 3,660. Lungs, the seller in Europe asking price is $312,650. And so, with that being said, I'm going to let this video go. You can look at this, but this is human organ trafficking prices, and this is what is going on, not only in the U.S., but it has gone on all around globally in different parts of the world, and it is a big business, and it is very scary that this has happened, and it has been unchecked for far too long. Having said that, thanks for listening.